Good afternoon, ladies and gentlemen. Artificial intelligence is no longer a concept of the future. It is reshaping healthcare today. From accelerating diagnosis to personalizing treatments, AI is revolutionizing the way medical professionals deliver care. But with greater power comes greater responsibility. How do we ensure that AI is used ethically, safely, and effectively in our medical practices?
Yes, Vinuk, that's exactly what we are here to explore today. So, ladies and gentlemen, we welcome you all to the interdisciplinary session on artificial intelligence in healthcare, proudly presented by the Center for Mathematical Modeling, University of Colombo, together with the Expert Committee on Artificial Intelligence in Medicine of the Sri Lanka Medical Association. In this session, we bring together healthcare and computing professionals with expertise in artificial intelligence and related research to discuss how we can harness the power of AI to improve the quality of patient care while addressing the challenges. I'm Devmini Jayalath.
And I'm Vinuk Tismalpala, will be your host for today. To formally inaugurate this session, I would like to cordially invite Professor S.S.N. Pereira, the Chair of ICCMM 2025 and also the Director for the Center of Mathematical Modeling of the University of Colombo, deliver the welcome address.
Good afternoon. On behalf of the Center for Mathematical Modeling, Department of Mathematics, University of Colombo, and Expert Committee on Artificial Intelligence in Medicine, and also on behalf of the Dean, Faculty of Science, I would like to warmly welcome all of you into this interdisciplinary session. Actually, the Professor Upul Sonnadara, who is the Dean of Faculty, was planning to deliver the welcome speech. Unfortunately, today we are celebrating the 500th faculty board things. So it's happening in the afternoon. So he's so much busy. So that's why I'm, of course, taking his duties here. So it's a great honor and privilege joining with you to provide the witness for this landmark session. I believe like that this AI is on board, but it's not no longer on board. So we are, of course, whether we like or not, we are forced to use the AI. And I believe like that in Sri Lankan context, we would like to work in our own comfort zone, where I believe we have to actually destroy these boundaries, and together expertise should come to the one forum where we could, of course, address all these problems. Problems are ultimately multidisciplinary. So our own disciplines is not multidisciplinary. So this is actually I believe like that this is the forum where medical expertise and the IT expertise, mathematical expertise and statistics expertise, all kind of like expertise together and try to find out the solution for the burning problem which we are facing now. I believe like that this will provide you the great opportunity. And the Center for Mathematical Modeling, Department of Mathematics, University of Colombo, and the Expert Committee on Artificial Intelligence in Medicine, Sri Lanka Medical Association jointly took this decision, and so that's why, of course, we are here. So let me welcome officially each one of you. First of all, I would like to welcome Dr. Palita Karunapema, Director Health Information, Ministry of Health, Sri Lanka. Dr. Suranta Pereira, President, Sri Lanka Medical Association and Consultant Pediatrician. Professor Kumar Mendis, Consultant, Faculty of Medicine, Sabaragamuwa, University of Sri Lanka. Dr. BJC Pereira, Consultant, Pediatrician, Professor Atula Sumatipala, consultant psychiatrist, and Dr. Taranga Samarasekara, consultant embryologist. I'm sorry, some words, of course, I'm not familiar. Mr. Rangana Samarasinghe, CEO, InSharp Technologies, USA, and Professor Hiran Javira, Director, ITAC, University of Colombo, Dr. Prabhat Lianage, from the Department of Mathematics. Right? So let me welcome all of you into this forum. I know like that all of you are very busy, but I must actually thankful to everybody gathering here and finding the expertise things with the AI and finding the solution to the future problem, or probably like that the problem we are facing now. And let me, of course, introduce, welcome all participants. So because of like this, we are here to have this session. So finally, again, let me welcome all of you into this forum. I believe like that this forum will provide you initial platform, but I believe we have to, our path is so long, but this is the initiative point. So thank you.
Thank you very much, sir. Next, I'm honored to invite Dr. Surant Pereira, consultant pediatrician and the president of the Sri Lanka Medical Association, whose excellent leadership fosters responsible AI integration in Sri Lanka's healthcare sector, to address the gathering. Sir, the stage is yours.
Good afternoon, Honorable Vice Chancellor, distinguished guest, esteemed faculty, colleagues, and dear students, especially Head of Department, Mathematics, Colombo University. It is an honor and privilege to address you today at this timely and significant interdisciplinary session on artificial intelligence in healthcare. On behalf of the Sri Lanka Medical Association, I extend my warmest welcome to all who have gathered to explore one of the most transformative forces in modern medicine. Artificial intelligence is no longer a futuristic concept. It is here, shaping the way we diagnose, treat, and prevent diseases, from clinical decision support to predictive analytics, robotic surgery, and personalized medicine. AI is redefining healthcare delivery worldwide. However, as with any powerful tool, its integration comes with challenges, ethical considerations. Data security, what about the data security? Equity in access. Do all of us have the same access to artificial intelligence and the computer work? And the need for human oversight. That is why today's interdisciplinary dialogue is crucial. The fusion of expertise from medicine, computer science, engineering, ethics, and policy making is essential to harnessing AI's potential responsibility effectively. Collaboration is the key. As you mentioned, we must cut across, we must remove boundaries, we must come together. That will cover our blind side, not just among different fields, but also across academia, industry, and policymakers. To ensure AI services serves humanity and uphold the values of equity, safety, and patient-centered care. As the oldest medical professional organization in the country, the SLM is committed to fostering informed discussions and evidence-based policies that ensure AI enables, rather than disrupt, compassionate, ethical, and high-quality healthcare. As the apex organization in Sri Lanka, giving leadership to 58 specialized colleges like College of Cardiology, Pulmonology, Rheumatology, etc. It covers all the body parts of a human being. We have an expert committee on artificial intelligence. 2015, we had our health policy. 2026, we should have the new health policy. I'm very keen on this concept of having a new health policy. In this process, we should identify the gaps. We should identify the new things we will integrate. So artificial intelligence and climate effects, the resilience for climate effects and climate smart green hospital should be incorporated. Many more. So WHO talks about 6 blocks which are important in policy decisions. What about the 7th block, the people? We must have an advanced policy and we must allow people and the leadership among the Sri Lankan citizens to engage and incorporate them. Then it will be a good health policy. So artificial intelligence health policy, the basic draft we have developed. What we do is we develop a policy, we want to launch it, and we play the advocacy role. And let us, this platform today, discuss technology and shape a vision for AI in healthcare, which includes ethics and look at sustainable for Sri Lanka and beyond. And I wish you all a productive and engaging session. Thank you.
Thank you very much, sir, for those words. Now, let me also welcome another significant figure in advancing digital health systems and AI-driven healthcare solutions in Sri Lanka, Dr. Palitha Karunapema, the Director of Health Information from the Ministry of Health, Sri Lanka. Dear sir, the session is now open for your insightful thoughts.
Good afternoon to all of you. Head Department of Mathematics, President SLMA, all the distinguished invitees, colleagues and students. Actually, it's a great pleasure to be here today. It's a very landmark event. We are actually living in a very exciting era where artificial intelligence is rapidly transforming the way we live day to day. For the past 2-3 years, AI has become a major talking point in every forum, every discussion, all the major discussions. However, those in the tech field know that this revolution has begun quite some time back. In healthcare, especially low and middle income countries, we face numerous challenges. Limited resources, workforce shortages, health system inefficiencies, and gaps in service delivery. There are so many things. We know that some of these things could be addressed through digitalization, including AI. But to make a real progress at local level, at our level, we need more than just the enthusiasm. We must take a structured, problem-solving approach that brings together healthcare professionals and technology experts. I'll take just one example. We treat large number of diabetes patients, approximately 15% of the population. And particularly at primary care level, 30% are treated at primary care level. However, many of them do not receive routine annual screening, eye screening, due to the limited access to secondary and tertiary care. We know that technology solutions exist to facilitate this eye screening through advanced imaging and AI-driven analysis. If you can harness these technologies to improve the screening accessibility and efficiency, it would be a game changer for these patients. So likewise, there are so many examples which we can highlight where digitalization and AI could support to solve a health problem. From it may be a diagnosis, it may be decision making, maybe a follow up of patient and prediction, predictive modeling. It can be anything. We need we need high quality data use in AI tool effectively. So that's a fundamental. So in health system, we collect lot of data, but certain situation that data quality is not adequate. It is important to remember that millions of structured and unstructured data points in Sri Lankan health system available, but yet unused or not adequately or efficiently used for their potential for application. One crucial aspect of AI integration in healthcare is understanding system-wide issues. Healthcare professionals must collaborate with the technical expert to understand the AI potential so we can co-develop solutions that are both innovative and practical. However, as we embark on these technologies, we must also mindful about the ethical application. Professor Sumatipal is here, so he can more elaborate on this, especially around the patient data privacy and security, and we have an act related to that. The responsible use of AI in healthcare must be guided by the transparency, fairness, and the ethical frameworks. Now it's time to move beyond the discussions and take pragmatic steps, leveraging AI for real-world healthcare solutions. Now we need to address those things in our capacity, because there are a lot of academics in Sri Lanka where they can support Ministry of Health, and SLM is also there. So working together is the important thing. We need to identify the key health challenges that can be effectively addressed using AI and implement solutions tailored to the local needs. To achieve this, it is essential to develop a collaborative platform where healthcare professionals, IT experts, policymakers, and researchers can work together, design and test, scale AI-driven innovation for better health outcomes. I suppose after this forum, if we can assemble a small team, with all different sectors, and come up with, identify few problems, not everything we can't tackle, identify few key health issues and come up with solution, because there are a lot of students are there here, they can work together with these projects. Today, we are fortunate to have an esteemed panel of experts who will share their insights and on AI in healthcare. I'm confident that their discussion will inspire practical solutions to some of our most pressing healthcare challenges. And I'm looking forward to engage in an insightful session. Thank you.
Thank you very much, Dr. Karunapema. So with that, ladies and gentlemen, we will now move on to our first plenary speech. I extend a warm invitation to Dr. U.P. Lianage from the Department of Mathematics, University of Colombo, and Member Expert Committee on Artificial Intelligence in Medicine, Sri Lanka Medical Association SLMA, to share his expertise on synergetic integration of mathematical modeling and artificial intelligence in advancing of healthcare applications. Sir, the stage is yours.
Thank you very much for the generous introduction. Indeed, it is my great pleasure to be in front of all of you today, especially our chief guest and other guests of honors in here who had arrived, President SLMA, and also the director from health information, and other distinguished guests. In front of you, I feel privileged to be. And also, we have a lot of students here today, so which means we are looking at the future. So, well, with the welcome note as well as the other two notes, basically, we try to understand the impact of AI in healthcare system in very abstract manner. So what I'm trying to do is here to summarize that abstractness into the level of application. So that is my attempt through this particular talk. So I'm talking about, in fact, integration of mathematical modeling and artificial intelligence systems in advancing of healthcare application. So with that title, basically, I would give a very brief outline. So here that. So first I will give a kind of entrance to the artificial intelligence as a perception. Then I would discuss some of the application which we developed using the artificial intelligence towards managing the healthcare. And then finally, I will actually give some sort of, conclusive remarks as Director Health Informations had mentioned to carry on with the further steps. Well, when we think about artificial intelligence, it had a long history though, but when I see our audience, we saw the artificial intelligence through Terminator. So what would be the perceptions if you see the artificial intelligence through this Terminator? Well, not positive. It had been elaborated through the time when this Terminator is just one single entity of giant network that actually trying to eliminate the entire human nations. So then the phase of artificial intelligence at the beginning, that is not really positive. So the people who are in my age, probably, we saw this type of movies, and then of course, our head had a root of bad impression about the artificial intelligence. Nevertheless, we did enjoy some of the movies too. So for example, every kid who were around 10, 12 years old during that time, they all wanted to own Knight Rider, wasn't it? So that is a positive side of the artificial intelligence that time. But today, with the news and also the invention that we see from different media as well as different platform, so the kit is no longer a dream. It's there in reality. However, when it comes to the further development during the early 2000, probably some of you are yet to born at that time, we had a kind of transformation. At that transformation, we tried to embrace the new technologies and machineries, in fact. But that time still, the machinery did not have the power to think. However, we were quite happy to embark robots. We were quite happy to utilize them in our day-to-day life. And then we actually enjoy the company of the robots during that time. Nevertheless, how about today? It's a different picture. So I guess we know these artists, 4 of them. They are renowned and well-known artists in Sri Lanka. Unfortunately, they are no longer with us. However, recently, maybe 1.5 years ago, I don't want to mention the company, they made an advertisement. In that advertisement, honestly, I was surprised because all the artists who were passed away, they gathered together and they performed. they gave a message. And sometimes I wonder then how it will be in future. So do we really need the artist? It's a different question. Nevertheless, there is a branch where we can look into. So the entertainment is one of the branch, in fact, where the artificial intelligence would persist in future. And also it is being assisted us in many ways in agriculture. Like the major problem probably in something like 20 years is nothing but the food and the water. So the AI is assisting on those directions. Something actually catch my eyes was quite recently is this particular, the frame, I took it from the YouTube, is a famous show host, Jimmy Fallon, very talented person and very enthusiastic and very joyful person. And then he usually interviewed the humans, especially the rock stars. So the right to Jimmy Fallon is Sophia. So a robot which has an ability to communicate based on conversations. So in fact, the Jimmy Fallon had a lot of problem during this interview. He mentioned then thereafter. He said that in fact, he was extremely difficult because his perception is to talk to a robot, but then the feelings, emotion, expressions through the face, he got confused. In fact, during the recording, he had stopped many times interviewing in the Sophia. So we are in 2025. That is the level we are in fact. So then the future, yet to see. Nevertheless, if I go beyond, so if I somehow try to be scope with my topic, then basically we are looking at a different capabilities of AI and then algorithmic advances that comes through the machine learning. Of course, the assistance system that generated by AI technologies, they are very much in healthcare. So in my opinion, it's not a battle to become the best doctor. In my opinion, it is synergizing with different fields to make the better world around us. So that everything has its advantages and also the disadvantages. The question is, we as a human being who pursue the intelligence, how we handle the situation. That's the most important part. And also I have a kind of, a small icon about the chat GPT, because that's something debatable. That is something actually we need to look into in a different angle concerning the ethics and everything. I do hope that people would discuss it during this summit. So to get an entrance, let me introduce very briefly what it's all about. So the AI, how do we define it? Artificial intelligence is the intelligence of the machine or software different from that the humans or animals. The question is, how different? Is that the capabilities? Is that different capacities, memory capacity, analytical capacity? What? So the idea of this human intelligence, they would differ by one thing, that is actually the emotions. So we do not know whether the artificial intelligence has emotions, because we do not understand our emotions as well. We do have emotion, we feel that is there, but we do not know, define it mathematically or using something else to put into the machine. So as long as that is not yet defined, we are in safe side. So the artificial intelligence, it has the three major branches. One is the machine learning. That is actually the part of the algorithms. So if you ask, what is the difference between machine learning and statistics, mathematics, computer science? Then I would say not much difference. It's just a collection of algorithms that been automated so that for a given circumstances, the algorithm, they themselves allow to learn something out of the environment where they are in, which means the data, to make some predictions. So if you think artificial intelligence form a person, then definitely machine learning would act as the brain of that person. And then, of course, the robotics, you are a bit familiar with it. So therefore, I do not want to go into too much of details. It's a hardware part. And finally, the machine vision is how the machines would connect with the other environment. As we see from eyes, as we speak from our mouth, we feel from our skin, the machine vision is about connecting to the environment. So now I narrow down my focus into to application of healthcare. The question is, what are the areas? In fact, our director, he had mentioned all the areas in healthcare is being advanced by the artificial intelligence. For example, public health epidemiology. So the area of epidemiology, the decision making, I will give some example at the end of the day. So they are yet to come though, but it's one of the area in which the AI is highly being utilized. The other one is that the medical imaging and diagnostic. Well, good news as well there, which mean, the duty of radiologist and the pathologist would be easier in future. On the other hand, it has different disadvantages. We will discuss them too. So, however, medical imaging is one of the area where the AI perform really good. Then predictive analytics and risk stratification, that's another area. And the robotic surgery and assistant, that's something very novel. So what we are looking at, the micro level robots that goes to direct to your vein systems, probably to your heart, and remove the blockages. So that is the new technology, nanotechnology, together with the artificial intelligence. That's what the scientists are looking at. Mental health and behavior analysis. This is something very, very interesting to study, but of course has to be very careful because a lot of ethical concerns are there. Nevertheless, we can use the advantages, algorithmic advantages that provide by the AI infrastructure in handling the problems in mental and health care. So of course, the major topic is the ethics. So the ethical conduct, can we let a machine to decide our fate? And there are other concerns about the knowledge, replication. Everything has its own limits. Nevertheless, the ethical concerns can also be handled through the AI platform as well. So when it is kind of, we use the problem to solve the problem. So when I look at the areas, so it is better to give some sort of concrete example so that we can actually materialize and like get kind of idea how those technologies could be really in practice. So the first application area I'm looking at is the medical imaging. So for that, I would take a concrete example. That's ovarian cancer. So I think the people, they know, like majority of you are from the health side, so you know better than I do perhaps, that this is one of the most severe cancer, and among the women particularly. And basically it's the 18th most common cancer in the worldwide and 8th among the women. And then of course the statistics regarding this type of cancer will empathize how important to do any measurements to mitigate it. So it is being predicted by the World Cancer Research Fund International that by 2040, the cancer cases of this type would increase up to 42%. Currently, early detection is limited to around 20 to 25%. And also, it is been well known among the medical field. If you had detect it early, the curing capacity is 70 to 95%. So then the question is how to detect it early as possible. Well, concerning that question, what we can do as a scientist. We are not the medical doctors. So that actually assisting the medical doctors to analyzing the histopathological images. So these are the example of histopathological images which are basically taken out of the patients who are suffering a different stage of cancer. So these histopathological images, they are being analyzed by the doctors, pathologists, and also like radiologists, and they understand the patterns. According to them, I also learned from them because I'm not that field. According to them, basically, if that could not be distinguishable in one stain of chemicals that been given to the patient before these tissues being extracted, so then what would happen? Basically, they have to conduct the test again with a different stain of chemicals so that they have a better view to judge whether the patient has the cancer or not. So this is kind of a way of like difficult processes. Nevertheless, if we look at the images and they are diverse pattern, probably we might find something from the image because human eyes, they see the color pattern and the changes. Nevertheless, computer eyes, which mean the algorithm, may process a complex patterns that may hidden within those images. The question is how to extract them. So this is what we were trying to do. So there are like image classification algorithms in artificial intelligence. I guess our curriculums, we teach them to the student. The fundamental one is this convolutional neural network, which is actually used to analyze such images and extract the patterns and then classify whether those images are belonging to the cancerous different stages or not. So the standard practice. In fact, actually, those become a kind of textbook example when we deliver the content of AI in our curriculums without much of the insight from the medical domain. That's a major problem. However, the basic algorithms, they produce a kind of a good accuracy, at least for the given data. Because we are confined, our knowledge and our derivatives are confined to the given set of data. And then out of these data, for example, in this study, they had shown that 84% can be correctly identified with the different stages of the cancer. But the question is, can we do better? So then we, as a mathematicians, we come into the game and then we look at these images in a different perspectives. So one perspective is that we define something called features. So in the process of defining features and identify them within the context of algorithmic implementation, that is what we call feature engineering, because every process has a beautiful word. So we use feature engineering for that particular word. Then what we do is basically we try to mathematically identify the distribution of colors on those images. And we try to identify the patterns and how they spread through the images. How do we do that? One is that what we call the Harlick dimension, that actually check the homogeneity of those colors across the images. And the other thing is that something called fractional dimension. So the fractional dimension, we can understand in a simple terms. So we all know that line is one dimension. Square is 2 dimension. Triangle, which is shown over here, is again 2 dimension. We are in 3 dimension space. So if you take some part out of that triangle, so you take the middle, take the triangle in the middle out of that triangle, and remaining triangle you have again continue with that process. At the end of the day, you end up with a kind of picture like this one. So if somebody asks, what is the dimension of this one? So that is actually the questions arising in the area of fractional dimension. So that particular case, we have calculated it is 1.58. So the cell similarity and everything. So the same thing can be applied to the medical images. So we can calculate the fractional dimension, and we together with the together with the other measures like Harlick dimensions, we combine the analysis and then we transform these pictures to that pictures. So these pictures are in fact not pictures, they are distributions of the different colors. And well, for us, we may able to identify them more clearly or more separately compared to the original histopathological image. So that is a simple idea. So these practices actually enhance the accuracy, and finally we have, instead of 84, we have 88% of accuracy. The question is, are we happy about it? Well, can we use these results? That's a major problem for the medical doctors. That I do not know. Why? Because they are being generated out of the data sets given by somewhere in the world. So is that data set applicable to our people? That's a question we should look at as a community from the healthcare and medicine. So we as a computational fellows or mathematicians or computer scientists, statisticians, data scientists, we can look at the data and we can describe what the data says. But to apply them, you need to have a much more better understanding of your ground. So we are not suitable to do that. But together, of course, together it is possible. So one more example with a different type, I think personalized medicine you had talked about, our director. So in his talk, he mentioned about something personalized medicine. So this is another one. Unfortunately, it is also from the area of cancer. So in this particular, the cervical cancer, when you detect the cervical cancer, it being usually the patient has to go undergoing these type of 4 tests: Hinselmann, cytology, Schiller, and finally the biopsy. Those are the standard tests which known to us that actually deploy for the patient to diagnose the patient. So then the problem is that, like, when the cancer is positive, which means the cancer is there, one or more tests can be positive. But we do not know which test would be positive. So if we know that, let's say Hinselmann is the one one would positive, then we could have applied them. But for some patient, when the patient bear the cancer, for some patient, Hinselmann get the positive results, which means it detect correctly. But for the other patient, it is not. So then the study has been conducted to clarify which test we should perform for a given person, not as a treatment, not as a protocol, but for a given person. So then we have to collect some data of the person, and then basically we formulate a research, like given such information of the person, age, and so on and so forth, how to get the order of we should probably make the test from the patient and in order to diagnose the cancer. So then, of course, the biopsy is the last one, according to the medical doctors, that what we should the last, and the other can be done preferably. So then the orders can be defined at the end of the day. This simple equation tells us the order. So this is not a miracle equation. It's simply like simple linear equation, which is actually multinomial distributions. So that actually multinomial regression gives us which order we should follow. So given the patient condition, this and this and that, which order we should. So along that way, we can minimize the number of tests. The more importantly, there should be a time. So time, naturally, there is a time in between tests. We can reduce it, and thereby the danger of the patient can be reduced. So we are not using entirely these tests to determine, though, these techniques to diagnose the patient. We use these techniques to assist the doctors in diagnosing the cancers. So these tests cannot be diagnosed. So that is one thing. So the other application, I go to the area of epidemiology. So we all experience COVID-19, so nothing to discuss about it. We know all about it. And then basically the idea is how we can use our knowledge, AI knowledge, in basically handling such type of pandemic level. Well, we learn it in a bitter way, but we know something about COVID. That means it's a respiratory problem, which means transfer from one human to other. So therefore, it is basically, if you freeze the entire community, then you can make the entire disease eliminated. But that's not possible. It's not possible. You cannot freeze the entire community. Nevertheless, if you do that, this will go away. However, the question is, what are the strategies? How to stop this disease? So basically, concerning this particular problem, we tackle the problem in a different way. So we have the number of patients who've been infected in a given area. We have the number of people who've been exposed and number of people who are living in that area. So we as a mathematicians, we don't care how the area looks like. For us, Colombo district, the shape is entirely Colombo, like Western province. The shape is entirely similar to the, let's say, Eastern province. In the morning, people, I heard that they were discussing about the topologies. Topologies, they don't have the shapes, so they all are same. So we see the same thing over there as well. So then basically we map this entire country into the cells where we can count number of people, count number of infected people, count number of susceptible people, and so on and so forth, and exposed people, and also the people who have passed away. Well, we developed the compartment models. So these things I don't want to, like, for you to go through each details, but I want to give a message. There is a mechanism which we can practice, which comes with that sort of ugly number of equations. So I put this one not to impress, but to at least show that there is a logical framework behind it that we can use in determining the progression of a pandemic or any kind of such communicable disease. So this particular problem, there are few parts in which actually we use the AI to get the parameterization. For example, this set of equation, it involves, so please do bear with me because they are ugly, as not good as those histopathological images, which are more friendly to you in that case. So this contains some of the parameters in which actually they are sensitive for the mobility of the human, So they are being estimated using the AI techniques, okay, machine learning particularly. So when you have that, so then you can tell that, okay, given a particular area, how the people move away and how the people come inside. So then you can find the patterns like this way. You can identify, given a time period of time, the movement, the public movement, and so on and so forth. And finally, you can find out how the spread of the disease going through a particular area to another. For example, this last row of the pictures. So this is the areas, let's say, where we detect the COVID people. So that time we had the buzzword for that, what we call the clusters. High impact clusters, yes. So the cluster spreading, that's what we call that time. So the cluster spreading, how that would work with the public movement, this is how we have simulated through this mathematical modeling. So then, of course, you can come across with the different part, then you have a different ways of basically identifying them. With these maps you can understand, but I will directly show the like last one, and then I'll come back to you. If you focus, so there are 3 clusters forming, you see. So the 3 clusters are forming, and then they slowly spread all over the region. So if you look at that as a region, which is actually not looking like the Sri Lanka, but you can like transform and think and analogize Sri Lanka. This simulation, it shows how the disease would spread. So when the disease spread, okay, this will reset in 100 days. And then how the number of exposed people will increase, how the number of recovered people would increase, and how many will pass away, and so on and so forth. And this one, it actually shows the dynamics. So what will happen basically at the beginning, you see the increase of the number, and then some point of time it come to the peak, and then it slowly decrease. So this is what it happened in this simulation. That's what it being illustrated. So the question is where we can utilize them in policy making. So for that, actually, we can think of the border spreading, the cluster spreading as it been shown in this simulation, and many other strategy determination platforms. For example, if you are thinking to releasing the people or releasing the lockdowns, sanctions or lockdowns conditions, then we can make some simulation before in hand to clarify how the impact would be, because we cannot freeze a country in such situation. So they are not actually, they would not let us know exactly what we should do, but we can use them as tools. That's also the important part. So finally, I would describe only one thing. So that is actually cancer models. Yeah. So probably this is supposed to be played, nevertheless. Okay. The idea of this particular thing is that basically we try to understand how the cancer growth would happen in a particular cell. So now it's working. So this simulation, it shows you how the cancer would grow in an organ. Okay. But they are not for day-to-day practices. They are for studying. For example, they can be used in the case of if you wanted to study the effect of the drugs and so on and so forth. So the effect of the drug can be parameterized and put into this type of model, and then thereafter you can check how the cancer would spread. So then without any further ado, I would give some conclusive remarks. So if you look at the different example throughout this simple slideshow, one thing is very clear. So every conclusion, every results that been derived out of all those study, they are highly biased. They are highly biased to the data it is being fed. So then the question is, do we have a quality data among us, and how we can develop such data sets in future so that we can actually use in the research. And the other question is that, in fact, how to synergize, how to bring the people from the different areas of expertise into same table and working together towards the betterment of the healthcare system in Sri Lanka. So those are the thoughts which we can actually summarize at this end of this conclusion. So then basically, thank you for your attention. If you have any questions, we can answer. Okay. If not, thank you again.
Thank you very much, sir, for your very insightful session. To move on with our next plenary speech, I'm honored to welcome Dr. Kumara Mendes, Consultant Family Physician, Faculty of Medicine, University of Sabaragamuwa, and the Chairperson of the Expert Committee on Artificial Intelligence in Medicine, Sri Lanka Medical Association, SLMA. A leading researcher in AI applications from improving patient care and medical decision making. His presentation will be From Algorithm to Life Saving, How AI is Shaping the Future of Medicine. Sir, the stage is yours.
Good afternoon to you all. Let me first thank you all for inviting us and giving us the opportunity to present our views on a very rapidly developing area, artificial intelligence in medicine. So my talk will be, the title will be From Algorithms to Life Saving, How AI is shaping the future. Let me first ask you a question. Fast forward to 2030, 5 years from now, not long. You have a pain, any of knee pain, and any one of us, not me, I'm too old, say young people like you, 30 to 40 maybe, or 25, you go to a hospital, crowded OPD, and you have two options. Now you are with a knee pain, you have two options. One is to consult a human doctor. On the other side, you have a young doctor. What would you choose 5 years from now? I'm sure if it is a heart problem, you will say, I will go and see a human doctor. But this is just a knee pain. Just think of who you should consult. So we move on to the presentation now. In the next 25 minutes, I will first give a short introduction to artificial intelligence in medicine and discuss 4 major applications that are being used and see what the evidence that we have got. There's a lot we can talk, but what are the real evidence? Because you, the present generation, always ask, what is the evidence that you have got? We can talk a lot, but what is evidence? And then a little bit of concerns, but the major concern of ethical issues, I will leave to my friend Professor. So I won't be talking on that. Go back to 1945, world's first electronic computer was displayed. It filled a whole room, just imagine. One personal computer filling a whole room. Just 10 years from that point, 1956, there was a conference in USA, diagnose conference, where a group of people, two guys of people, computing and cognitive science, the top minds got together, and they want to discuss how to make machines more intelligent. Just 10 years after the first computer was displayed. And here at this conference, John McCarthy called the word artificial intelligence. It is at this conference. And they always, when computer scientists and computer scientists get together, they want to put doctors in some kind of box, right? So, in the statement was issued at the conference, and I want to just one sentence. They envisage computers could emulate doctors' diagnostic abilities, not all abilities. Doctors have many abilities, right? But only diagnostic abilities, leading to a concept of doctor in a box. In a few summers, how dare they make this statement? Right? Few summers is few years, right? What happened? This few years or few summers extended to about 70 summers now. Yeah, about 70 years. I think if at all, now you can think of putting doctors' diagnostic abilities in a box. We are at this point. So we move fast forward to year 2000. This is a true story. A seriously ill child was admitted to a London emergency care unit in the early 2000s. At the time of admission, the doctors could not really diagnose the disease, and the child had to spend about 3 to 4 weeks in the ICU, because maybe God's will or doctor's abilities, one of those, right? So child survived, and it was thought to be after 2 or 3 weeks they decided this was a rare complication of a common disease, chickenpox. We normally tell Pepper, right? We don't even go to the doctor when we get chickenpox. Just, Devyangil Dakil again. But this child had a rare complication of that chickenpox. And the father of the child was a bank and a computer expert. He didn't want to sue the hospital. Normally, we'll sue the hospital and claim a huge amount, right? He was a very nice guy. He said, together with the doctors in the emergency unit, they made a program where the doctors could enter the symptoms of children with their age and the symptoms, and then the computer will give a probability list of all the diseases, not even forgetting the rarest complication. The program was named Isabel, and this is the Isabel after discharging. Isabel was the first AI-assisted chatbot specifically made for medical use. It was later renamed Babylon and was used in the NHS UK for maybe a decade. So this was the medical use of, really it started with a real life situation. Prabhat gave a very good introduction to artificial intelligence in medicine. So, artificial intelligence in medicine uses, very simply put, because doctors don't understand complicated mathematics. My head was spinning, and a few colleagues were looking at each other when Prabhat was, right? We are in two different worlds, right? Understanding natural language, recognizing images, making predictions, and engaging decision-making process. This is a very simple definition of what we do in AI. Now, as I told you, I will take 4 state-of-art applications in healthcare and the evidence that we have. These two gentlemen, Demis Hassabis and John Champer, were awarded the 2024 Nobel Prize for Chemistry for their piece of software, AI-related software called AlphaFold. This is again very recent things. Why did they get the Nobel Prize for Chemistry? Okay, I will try to explain in simpler terms. As you know, proteins, our body is made of proteins. One of the key proteins' functionality depends on the shape of the protein. Right? So, if you can determine the protein shape, you can design drugs like a lock and key appearance. Lock fits the key. So, what we want is to make this shape. If we know the shape of the protein, we can put the medicine onto it. Right? What AlphaFold did was to get the shape of the protein in the lab prior to this AI application. It took from 5 to 15 years. Can you imagine? 5 to 15 years to get a particular shape of a protein. What this AlphaFold did was, it decreased the timeline to few days or weeks. Otherwise, you won't get a Nobel Prize. Right? So, though they speeded up the manufacturing of vaccines, and that was during the COVID outbreak. And they used this technology to, because this technique could detect the protein, spike proteins of the SARS-CoV virus. And then the drugs and the vaccine manufacturers decided, right, we will go into this target. So this is why these people are awarded the Nobel Prize. So accelerating drug development from years to just weeks. And recently, using this technology, a company had designed a drug within 46 days for a disease called pulmonary fibrosis. That means in our lung, the normal lung tissue is replaced by useless fibrous dead tissue that is called pulmonary fibrosis. Right. So the drug they discovered within 46 days, and with all the other details, they said spending $2 million, that is nothing for the drug manufacturer. I think doctors will know $2 million for a drug is absolutely nothing. And within 1.5 years, they had introduced the drug. So it is a huge, huge step in drug discovery, but artificial intelligence has done. The other second application is, as Prabhat touched is image analysis in radiology. In Sri Lanka, lung cancer is the second leading cancer in males, 10.6, and breast cancer, the leading cancer in females, 26%. Then, why radiological AI applications are important? Why radiological applications are important? Radiologists can easily do it. It is time and fatigue. I will just show you, this is one section of the lung, a CT lung. One cross section of the lung. For a radiologist to read one person's CT lung, it takes multiple sections, right? Imagine if the radiology, you have to look at a screen and detect, can you even detect this from this small area? What is the difference? So the human radiologist has to go through and detect these small differences and detect this person has lung cancer, this person does not have lung cancer. It's a very tiring thing. And humanly, only a certain number of scans can be read by a human being. They get tired. When you get tired, you make more errors. Right? So, an AI application does not get tired. You can wake the application up at 12 midnight or 4 in the morning. It will read 5 scans, 15 scans, or 25 scans. No problem. This is why imaging has progressed. So, I always told you, I will give you the evidence. What is the evidence that we have? Otherwise, we can talk a lot. So, lung cancer detection evidence, diagnostic test accuracy of artificial intelligence-based imaging for lung cancer screening, a systematic review and meta-analysis. Right. 2022 study, this systematic review had more than 26 studies and about 150,000 patients. Not a small thing. So it is robust evidence that we have. The conclusion was AI-based imaging effectively detects lung cancer and be incorporated into lung cancer screening programs. It's a huge thing. Without this kind of evidence, the medical profession won't even look at anything. Technology in practice. I think the radiologists can't even argue with this because this evidence is so strong. is about mammography. Still behind image analysis, every female who attends, say, 40 years, I think now the age will vary, it was previously 50 years, 40 years, they recommend a mammogram. And after you do that mammogram, they will tell you whether it should be repeated in 2 years' time, 1 year, or 3 years. Right? So it will detect breast cancers even before you can palpate the cancer at very early stages. So all the females here, right, 40, when you have 40, or earlier than that, if you have any relative in your family with a history of breast cancer before that, go and get a mammogram done. So, mammograms can be very small, but very large even, but highly, can you see, it is difficult to detect. Right. So, what evidence have we got in mammographic with AI assistance? So, artificial intelligence for triaging of breast cancer screening, mammograms, and the workload reduction, the system meta-analysis of a deep learning software. 2023 study, again 13 studies, more than 150,000 patients. The conclusion was deep learning computer-aided triage of breast cancer screening, mammograms, reduces the radiology workload while maintaining high sensitivity. As you know, for a screening program, we need highly sensitive, a test that is highly sensitive. The sensitive, so we have the ideal test, and we must use this kind of thing to lessen the burden of radiologists. Right. The third application that I would like to discuss is personalized medicine. What is personalized medicine? Think of personalized medicine as tailoring healthcare to fit you like a custom-made suit. So, if you want to get a full suit done, male or even female wear suits now, you have two options. You go to a ready-made shop and you get a ready-made suit, or you meet a tailor. Go to a tailor, give your measurements, you have to spend more money, but you get a very fitting, nice suit done for you personally. So right. So personalized medicine, we will take an example and show you. Personalized treatment for hypertension. You all know about high blood pressure. Personalized hypertension treatment recommendations by a data-driven model. We don't have this kind of systematic reviews. I could find a very small study, but you will understand what they are aiming at. So there were 42,000 patients with high blood pressure. They divided into two groups. And one, the doctor. We have about 10 to 15 drugs for hypertension that we use normally. Tarang, is it correct? 10 to 15, nothing more. But you don't know that kind of thing. So we will say, right, you get this thing and take very serious look and, we write the prescription. So one half did that. The second half, they put this AI application, but this was done in the US, where everything patient has, drugs, treatment, investigations, hospitalization, everything is electronically recorded in the EMR. So the AI looked at the EMR and his maybe bank balances, purchases from whether he smoked, whether he had 2 wives or 3 wives, everything. Social history, family history, everything. And then wrote a prescription of the same 15 drugs one. These two groups were about 6 months, they saw that the data-driven model, AI group, had a lowering of blood pressure, about 70% lower blood pressure than the other group. Can you imagine that kind of thing? This is for just a normal, day-to-day, very common illness. When you bring a data AI model, it completely overrules the normal doctor with the same kind of drugs. Right? So, I think it's really worthwhile having this kind of very small application, but only hitch is, I think the Director of Information is here. We have very limited electronic medical records, all the things are paper. With paper, you can't do this kind of thing. I think when I came also, I met Dr. Palita, and he said there's another, I think we have about 100 hospitals, OPDs running electronic medical records, and another set of hospitals are starting electronic records. So if we have electronic medical records, this kind of thing will be very easy to introduce. And the last one, symptom checkers application. I think most probably this is the commonest use of AI technology, where there are websites. You go and put your details, 26 years, male or female, and I have these symptoms. What is the probable diagnosis? What am I having? And the thing will list down 8 or 10, giving the probabilities. These are symptom checkers, and some of the symptom checkers, like EDA, can be even downloaded into a mobile phone. Right. So hugely people use this kind of symptom checkers. So what are the literature say about the symptom checkers? 2023 study, a total of nearly 21,000 studies were identified, but only 14 studies were methodologically sound. But the verdict was, conclusion, although online symptom checkers have potential to provide accessible and accurate healthcare advice and triage recommendations to users, more research is needed to validate their triage and diagnostic accuracy before wide-scale adoption in the community and healthcare settings are. Right? This is not very good. But what happens? People do exactly this with a large language model like ChatGPT. They go in there, type in the thing, and get the advice. So, we have to be very careful. As you know, ChatGPT was not designed for anything medical. It is just a common large language model, and they don't recommend using it. But it is exactly what our people are doing. If you are wondering about large language models, there are specific large language models designed for medicine, like MedPal, Google's version, but that is not free for use. You have to pay something, $20 to $30 a month if you are using this. Right. So this is the problem. And then I have to tell something about DeepSeek. This is now open weight. I don't understand really the difference between open weight and open source. But one thing that I had just previously talking to Prof. Hiran, I was wondering whether somebody is running this. He said, you are running DeepSeek in your, that is marvelous. Within 2 weeks of, I think, releasing, we have at least somebody who runs the model, and my plea to you is, can we use this kind of large language model with our data set, health data set? Dr. Palita is here. He has access to, I think, a huge number of data sets that are electronic in Sri Lanka. So can we collaborate and get something out of own data to our people that will be accurate, not like ChatGPT. It uses a completely Western, Northern Hemisphere data set. So I will tell you what happens. Just think, if our patients, some of the patients, type, I have fever, headache, body aches, tell me what diseases I have, most probably it will list because it is looking at trained data in the Northern Hemisphere, USA, UK. Do they have dengue there? No. Leptospirosis or viral fevers, it will not be an accurate list of probabilities that we get because it is not our data set. So we have a chance of really giving our people a good large language model based on our data in the near future. Yeah, closing towards them. Do you believe in horoscopes? I'm sure you, 75%. Can you just put your hand up? Not the front row. I don't want your horoscopes, right? So, horoscopes. Right. You have nothing. I'm sure if you don't have, your parents will have, for sure, right? So, if you give them the accurate birth time, you will get the horoscope. What if I told you we have also horoscope, and this is horoscope? Do you know what this is? ECG. Right? Horoscopes will predict your future. Right? Don't laugh. Right? So normally an ECG is taken to detect heart problems. Whether you are having a heart attack or not, that's a reason. Right? Whether your heart is beating regularly or irregularly, that's kind of thing that we use it. Now, AI applications, I couldn't even believe that they are doing this kind of thing. This is what they have done. AI, these are not one study, there are separate studies done using AI applications. Right? Just a normal ECG, not even the age and sex was written. They could identify the ECG person's age and gender, whether they are anemic or not, you know. How can you detect anemia or not? Whether your thyroid gland is overactive or not, whether you have kidney disease, whether you have pre-diabetes. These are all done, and I checked some of this because I just couldn't believe how they have done this in applications. So, isn't it like the Handahana horoscope? If somebody comes, go and get and want to see the future. I don't want to see the future of my, yes, I have seen a lot of past. So I don't see but you, some of you, will want to see your future. Get an ECG and come. I can tell you where I consult after this. Right, so, a little bit, if you want a little bit more details, a retinal scan, it will cost a little bit more, but the retinal scan has done the same thing. It can predict Alzheimer's disease, Parkinson's, liver, gallbladder, kidney disease. If you want to spend a little bit more, it is a little few minutes thing. You have to get to a optometrist and they will do a retinal scan. If you pay money, they will just do it and bring the scan to me. Not me, I will tell. Right. So, this is what AI has been doing for medicine. We are nearing the end. Jeffrey Hinton, again Nobel laureate and the godfather of AI. He is the one who, against all odds, suggested the neural network years ago, and people did not, he was laughed at actually, when the functioning of the brain and the computer, he described this thing. And just about 1 month ago, he was interviewed by a UK channel, TV channel, and this is what he had to say about healthcare. In the short term, AI applications will do wonderful things, for example, in healthcare. You are going to be able to have a family doctor who's seen 100 billion patients. Family doctors don't see 100 billion patients, but the AI technology that exists will bring that experience. Who knows your DNA, who knows the DNA of your relatives, knows all the tests you have done on you, and these are looking at your electronic medical record, and can do so much better medical diagnosis and suggestions for what you should do about that's going on in you. Right? So this is his vision of healthcare. And a little bit of concerns, I think Prabhat already touched this. AI applications today available, ChatGPT mainly, uses a completely different set of data that comes from the northern hemisphere. It is not our data. So I told you what will happen. And the other thing is, before a doctor writes a drug, the drug has to be first given a certificate by FDA, the Federal Drug Authority in the US, and then our local authority, NMRA, will look into it and say, right, this is suitable for, then only we can prescribe. But nothing of that has happened in AI applications. FDA has a special section for AI applications and they are going to act similar to releasing a drug, releasing AI applications to patients and doctors. You all know about hallucinations. My one question is, right, we all know hallucinations, but what if a normal citizen asks the question and the large language model hallucinates, and the person does not know whether this is hallucination or truth? What will happen? There is a huge problem with using large language models. Now the question again. The question I asked you when I started the discussion. Do you have the knee pain now? You are in an OPD. You have two options. Would you choose a human doctor or an AI doctor? Let me put another small. The human doctor's queue is very long. There is a short queue for the AI doctor. What would you choose? Young people. Not decided? Right, one hand at least. Right, this will be my last slide. Eric Topol is a cardiologist, an expert in AI in medicine. He has written a wonderful book called Deep Medicine. It came out about 5 years ago. What would be the ultimate aim of using artificial intelligence in medicine? He says, it will increase the time doctors talk to their patients, establishing the doctor-patient relationship that is fast dwindling. We are accused, the doctors are accused, not even allowing the patient to sit down, not to talk in the OPD. Right. If you have a channel consultation, maybe the doctor will allow you to sit down. But if the doctor has about 30 to 40 patients, some of my colleagues I know about 75 patients, 100 patients, sit down and stand up, even in private. So the AI applications will look into all these diagnosis tests, everything, and give the summary so that the doctor and the patients have time to talk to each other, especially as a patient to ask any question that you like and get the answers from your doctor. Isn't that what we all want to do? So Eric Topol, the cardiologist, says it will be the thing that AI gives the humanity. Thank you.
Thank you very much, Dr. Mendes, for that engaging presentation and definitely for leaving us with something to think about. So we have a small token of appreciation for you. To present the token of appreciation, I cordially invite Director, Center for Mathematical Modeling, University of Colombo, Professor Sanjay Pereira on stage.
UP Learning from the Department of Mathematics, University of Colombo, receive his token of appreciation also. And also, Dr. Karnateva, Director of Health Information, Minister of Health, Sri Lanka. Thank you very much, sir. He is the token we received. Thank you very much, sir.
So with that, ladies and gentlemen, quite a bit of presentations that we heard today, I guess were eye-opening for all of us. So with that, we would like to take a small break for tea and refreshments. So please go to the second floor and, sorry, the third floor, so you can use the elevator or the stairs.